how could this possibly happen that you would take our loved one, charge us a lot of money to take care of her, and then not take care of her?
The family of a woman at the center of a state sexual assault investigation is calling for more accountability for her caregivers. Her case highlights the potential for hidden harm in Texas nursing homes and assisted living facilities. Investigator Avery Travis discovered in most cases when the state finds evidence of abuse, the homes are never cited and rarely penalized or fined. She's back to tell us how advocates and lawmakers hope to address the quality of care for these vulnerable Texans this legislative session.
When I go by their room, they're sitting in their chair looking out the window.
Previously as the mayor of DeSoto and now as a state representative, Carl Sherman tries to spend time visiting senior Texans in their nursing homes and assisted living facilities.
We've got to be willing to walk the halls of those nursing homes and go in and find out what is their concern and how they're being treated.
Do you think, from what you've seen, that Texas is doing the best it can to protect these people right now?
I think we could do better. We could do more.
Texas is a state where it is dangerous to be old.
Despite safeguards like legally required background checks and state inspections of these facilities, patient safety advocate Ware Wendell believes the for-profit structure of so many Texas nursing homes and assisted living facilities can lead to cutting corners.
You have to make danger unprofitable in this state. We need real enforcement, not slaps on the wrist, $1,000 here, $5,000 there, but meaningful penalties.
KXAN reviewed logs of abuse allegations in Texas long-term care facilities over a nearly 4-year period and found, of the cases where the state found evidence of abuse, facility operators were only cited 30% of the time. Often because facilities had addressed the problems by the time the state arrived to investigate. In cases where the home was cited, KXAN found even fewer instances where the operator had to pay a fine.
So we've had a significant decline, and again, we were already behind.
In a legislative hearing last year, industry leaders explained operators need more resources, not less. They described how expensive it is to provide quality care with the current state of Medicaid funding, especially as they try to compete for quality staff with other healthcare professions.
It's a significantly large number of patients who are being served on a daily basis, 24 hours a day.
Addressing the staffing crisis remains a legislative priority for many industry advocates again this year. But others argue any funding from the legislature should come with strings attached.
Transparency when it comes to ownership, making sure the funds are going to better quality staffing, making sure funds are going to the direct care of residents rather than the pockets of the facility themselves.
AARP Texas is also calling for more funding for the Health and Human Services Commission, which regulates these kinds of facilities.
I think that we all have a fiduciary obligation to focus on the most vulnerable in our populations. And as a member of Appropriations, I intend to make sure that we do a better job at taking care and providing the resources that they need.
For Representative Sherman, it goes beyond just long-term care facilities that are regulated by HHSC. He and other Dallas area lawmakers are talking about how to protect all older Texans, especially following a string of suspected murders in independent living communities in North Texas over the last few years. Several bills have been filed to address these populations, including one requiring background checks for staff in less regulated, independent senior housing. As far as our investigation goes, lawmakers have already heard from HHSC about some of these issues. In a report published last year, the agency outlined increasing staff workload over the last decade and a soaring number of investigations during the pandemic. But the agency says staffing numbers have no impact on how they prioritize abuse investigations. Still, in 2020, the agency did create a separate division to help assess monetary penalties for the facilities with the most serious compliance issues. The report says this did result in a more independent and objective decision-making process about these penalties. For State of Texas, I'm Avery Travis.
Thanks, Avery. Coming up, cancer funding in Texas gets a big boost. How the plan could pump up research projects all across the state.